Hello, my name is Shalita McIntyre, and today my informative health speech is going to be about Chiari malformation. Chiarian battlefield. Chiari malformation, a condition in which brain tissue extends into the spinal canal, and it is present at birth, believe it or not. Girl interrupted but fighting back. One of my mom's favorite quotes to say, as she herself has battled Chiari pretty much all her life, but she wasn't actually diagnosed and didn't know about it until 2014. And she did need surgery. After surgery, things have been a lot better. She has gotten so much relief from it. This speech will introduce listeners to a condition that's not very well known. It is considered rare, but it may be way more common than the world believes. Although typically it is not life-threatening, those diagnosed and given treatment for Chiari malformation are well better off. I will start by talking a little more in depth about symptoms of Chiari, then we'll jump into the diagnosis itself and how they find out if you have it or not, as well as treatment, which usually requires surgeries depending on how bad it is in there, and sometimes even medications. So to start with symptoms, when you go to the doctor, do they often ask you what your symptoms are? I feel like yes, because that's the best way to kind of start figuring out what's going on with you. So here's a list of symptoms that I have here. It's not all of them, but it is the bulk of the symptoms. It's going to be debilitating headaches, neck pain, dizziness, visual disturbances, numbing and tingling of the hands and the feet, aphasia, change in heart rhythm, depression, as well as chronic fatigue. Here are some other examples of symptoms that people may have along with Chiari malformation. Diagnosis. How would you know that you have this condition? Well, I'm sure a lot of you know that the medical field is very developed these days. We have a lot of technology now, and that's going to be the main use of diagnosing Chiari. They use x-rays and they also use CT scans and MRIs. X-rays can actually detect the herniation, while CT scans and MRIs give you a better image, a glimpse inside, and it'll show you any extra abnormalities, such as some people may also end up with hydrocephalus, which is fluid building up inside of the brain. Treatment. All right, so this is usually inclusive with surgery and potentially becoming a zipper head. The term zipper head actually comes from the incision that they do from the neck all the way up to mid-head, as you may have seen on my mom's picture in one of the first slides. And so surgery is most commonly, it's going to be the posterior fossa decompression. Most people that undergo this surgery, they come out with so much relief. It is usually extremely beneficial to these Chiari patients. Death is very rare in these instances, but it is still possible, so you have to make sure that you have the best medical team for this surgery, and they must be extremely experienced professionals. In conclusion, it can bring a lot of pain and suffering, but if diagnosed properly and you are under the right care, it can be managed and very beneficial. It is a long battle and it's never truly over, but if you are guided by the right support team, the right medical team, then recovery and treatment and everything that goes with it, it can make a huge difference for the patient. Like I said before, my mom was in her mid-40s when she was diagnosed. It was a very inconvenient thing and it was tough. But I think everyone, friends, family, all together, we realized that she is tougher than Chiari itself. And so I wholeheartedly agree that she was a girl interrupted, but every single day she is fighting back. And here are my references. Thank you guys for listening.